Good day, I'm Erica U. Fernandez from BSN1E. So for today, I'm going to do is the heart assessment. So in this video, I'm going to do is how to escalate the sounds of the heart of a real person. And paano ko nga ba yun gagawin? Simple lang, makikinig tayo sa sound or rhythm ng sound ng heartbeat ng isang tao. And then I'm going to identify the S1, S2, S3, S4 heart murmurs by listening to the sound of it. And then, isa-cite ko rin yung anatomical site nito. So, bakit nga ba natin kailangan pakinggan yung sound ng isang heartbeat ng isang tao? And then, ano kaya yung purpose nito? So, we need to hear the sounds of the heartbeat because in order to know if we are alive and if the BP is normal. And the purpose naman po nito is the sounds of the heartbeat is reflect to the turbulence. By hearing the rhythm or sound of a heartbeat of a person, we can easily count the regular rate of it. But also, we can also assist the patient. So whenever we hear S1, S2, those valves are closing. So whenever we hear the sounds of loop, 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 it is usually the S1 or the tricuspid and mitral valves closing. Kapag naman ang narinig natin yung dub, 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 it is the S2 or the aortic and pulmonic valves closing. So in this case, kailangan natin ma-distinguish kung ano nga ba yung sounds ng S1 and S2. And by that, kailangan din natin na yung patient natin is naka-different position or naka-setting position to clearly heard and understand the heartbeat of a person. So ngayon, dahil nalaman na natin yung sounds ng S1 and S2, hahanapin naman natin yung anatomical site nito. So mahahanap natin yung anatomical site sa clavicle ng patient natin or in the angle of the Lewis. To easily check the sounds or heartbeat of a patient, kailangan yung position niya is naka-setting position or naka-lay down. And then, kailangan din natin ipa-remove yung cloth niya or yung damit niya to easily conduct a heart assessment. By checking the chest of the patient, we should always remember the mnemonic that all patients take medicine. The herb point is in between of the pulmonic and tricuspid, and the seminicular valves are the aortic and the pulmonic, and when they close, you can hear the sounds of the S2, wherein the S2 is the most at the base of the heart of the patient. And then, when we hear the tricuspid and mitral, it can be the ventricular valves, which are AV valves. So, next naman natin gagawin is the osculating. So, when we oscillate, we usually use the diaphragm of the stethoscope or the bell and lido, all the anatomical sites. So, next ko pong gagawin is the osculating the sounds or the rhythm of the heartbeat of the patient. So, dahil wala akong stethoscope and wala din akong diaphragm, so, assuming na lang po na meron akong diaphragm. So, ang una ko pong i-check is the aortic and the pulmonic valves or the S2. Yung usually sounds niya po is dub, dub, dub. And second naman po na i-check ka is the tricuspid and the mitral valves. Yung sounds niya naman po is lub, lub, lub. So, yung S3 and S4 naman po, ito po yung different kind of sounds naman po na maririnig po natin sa S1 and S2.